pass this controversial bill without members even actually having to vote on it. Now, using a legislative sleight of hand to pass an unpopular bill represents an arrogance in Washington that is absolutely becoming so frustrating that we have to change politics and business as usual in Congress. And I yield back.
Back the gentlelady from the District of Columbia. What purposes do you rise? Without objection, so ordered. The gentlelady is recognized.
Madam Speaker, the American people are fed up with the most costly health care system in the world with too little good health to show for it. We are 38th of 195 countries in life expectancy. Pity those who think they can run on the theme, repeal health care reform. Democrats opposed Bush's version of prescription drugs for seniors because, unlike our health care bill that's coming to the floor, the Bush plan added billions to the deficit, didn't pay for the bill, and cut seniors off with a donut hole. But we never ran on the outrageous theme, repeal prescription drugs for seniors. Instead, we vowed to fix the prescription drug law if Americans would give us control of the Congress. They did, and we are. We are closing the donut hole, and we are paying for it. You're entitled to criticize, indeed to change the health care reform Americans have been waiting for almost 100 years. But it is simply a fool's errand to oppose it and madness to try to repeal it.
For what purposes does the gentleman from Pennsylvania rise?
Madam Speaker, request unanimous consent to address the House for 1 minute and revise and extend.
Without objection, so ordered. Gentleman is recognized.
Madam Speaker, from the Cincinnati Enquirer to the Washington Post, the editorials today tell the Democrats to stop this health care reform and start again. I agree, because I've always based my health care work to increasing access. This bill fails at increasing overall access. The Senate bill expands Medicaid to cover families earning up to 133% of poverty level. The Medicare rolls will explode under this proposal, but what does that mean? Some 40% of family practice physicians currently do not accept Medicaid patients. This is expected to increase to 60%. Some 60% of specialists currently do not accept Medicaid patients. This is expected to skyrocket to 80%. This bill expands Medicaid beyond its capacity to absorb patients. It cuts Medicare for seniors and leaves malpractice tort reform untouched and skyrocketing costs in place. This bill has the potential to bankrupt rural hospitals that have a disproportionate share of the problems inherent in the bill. This adds up to less access and lower quality. That is not reform. I yield back.
Gentleman yields back. For what purpose does the gentleman from Illinois rise?
To address the House for 1 minute.
Without objection, so ordered. Gentleman is recognized.
Thank you, Madam Speaker. Madam Speaker, the United States and Israel have long shared an important friendship. That friendship is rooted in close moral and strategic bonds built on common values, common interest, and common concerns. Today, that friendship is being tested, but we must not allow ourselves to be distracted from the concerns and goals that bring us together. The threat of nuclear Iran is too great, and the peace process is too important for us to spend more time engaging in critical rhetoric of our most important ally. It is time to put aside the rhetoric and reaffirm our bonds with Israel. We must make it clear that we are united in our opposition to a nuclear Iran. While no one gains by an escalation of tensions, we must make it clear that we value and support our relationship with the state and people of Israel, and I yield back.
Gentleman yields back. For what purpose does the gentleman from California rise?
Permission to address the House for 1 minute, revise and extend.
Without objection, so ordered. The gentleman is recognized.
Madam Speaker, right now, behind closed doors, negotiations are taking place on the $1 trillion bill to provide for the government takeover of health care. I find it baffling that instead of talking about jobs, my friends on the other side of the aisle continue a path toward radically changing 20% of our economy. Small businesses continue to struggle, but rather than creating an environment that eases financial burdens on business, the administration and this Congress are creating uncertainty through health care takeovers, cap and tax, deficit spending, looming tax increases. A recent analysis of the current health care bill shows that it could cost America 1 million jobs by the end of this decade. That is unacceptable. I recently polled my constituents. 2/3 are absolutely opposed to the health care bill. They want Congress to start over, focus on items we agree on. Let's return to the question of how we can make health care more accessible, more efficient, and less expensive. Let's kill this bill and save American freedom and our economy. Thank you, and I deem back the balance of my time.
Gentleman yields back. For what purposes does the gentlelady from Pennsylvania rise?